Thanks, Nick. All right, let's start with a poll. And I think for this poll, we'll just utilize the chat to gather the responses. If you guys can put in the chat your entity's involvement with the 340B program. So let us know if your organization is a 340B covered entity, if your organization is a pharmacy contracted by 340B covered entities, your organization is not a covered entity, but often works with one, or if your organization is not involved with the 340B program at all, or really you have no idea what your organization's involvement with the 340B program is. And I know the answers are, Judy, I know the answers are coming directly to you, so perhaps you can share some of the insight with us.
You bet. Let's see. ICE, I have no idea. A couple of those D, not involved A. Covered entity, Vanessa says C. A couple of C's, a couple of A's. Jamie says A, or J. Marie says A, excuse me. It looks like we have most of the answers in.
Awesome. Well, that's great. Thank you for giving us the opportunity to understand your organization's involvement with the 340B program. We'll now dive into today's content and begin by exploring what the 340B policies and procedures are. But before we dive into the topic, let's quickly review some of the concepts from our first presentation in case if you missed it. So in our first presentation, we learned that at the core of it all, 340B program compliance is the responsibility of the covered entity. Similar to how a hospital has to follow rules of accrediting bodies, for example, the Joint Commission, just like that, 340B program has its own set of compliance expectations, and it's the entity's responsibility to ensure they are operating a compliant 340B program. So some key areas for compliance considerations are preventing diversion, duplicate discounts, and appropriately operationalizing entity-specific considerations. Here's a slide outlining different areas or different settings of the 340B program. The covered entity that registers for the 340B program is considered the parent site or the main site. The parent site can have child sites, which would be sites that are associated with the parent site where the 340B program is administered. Another setting is the entity-owned pharmacies. So these are retail or outpatient pharmacies that are owned by the parent site. And the last of the universe or 340B settings are contract pharmacies. So these are also retail outpatient pharmacies, but they are contracted with the parent site. The covered entity maintains the responsibility of program compliance and operations at all of the contract pharmacies and within all the different 340B universes. So we'll now look at how the 340B policies and procedures help us ensure 340B program compliance across all the different program areas. So this guiding document helps us document a few things. First, it helps us outline operations for each of the compliance cornerstones that we mentioned earlier, including diversion, duplicate discount, entity-specific considerations. It also helps us highlight our process for oversight and how the entity will maintain oversight of the program. And it's also the hub for outlining different program stakeholders. So since 340B program integrity spans outside of pharmacy, for example, with IT, internal audit, and beyond, it's important for us to outline how different stakeholders play a role in the 340B program compliance in our policies and procedures. All right, we'll now spend some time exploring core areas of the policies and procedures, and to make it easier for all of you, we'll present this as different chapters in a book. Each chapter will be a unique section within the 340B policies and procedures. So our first chapter of the policies and procedures will be dedicated to site eligibility. In this area, the covered entity has an opportunity to demonstrate how they qualify to participate in the 340B program. The statute outlines different ways in which an entity can qualify for the 340B program. So this would be where in the 340B policies and procedures, the entity will state its qualification and provide supporting documentation. This will also be the section of the policies and procedures where the entity will list all the locations where 340B drugs are dispensed or prescribed from. In the next section or the next chapter of the policies and procedures, the entity will outline how they define a 340B patient. So this is where the entity will state where the patient should be seen, that the patient's status should be outpatient, and that the entity will maintain the patient's health record and ensure that the patient is seen by a credentialed provider. In this section, the entity will also have the opportunity to define what a credentialed provider means to the entity and how the list of credentialed providers is maintained by the entity. So going back to some of the compliance cornerstones that we reviewed earlier, this section of the policies and procedures will help in preventing diversion. In the third chapter of the policies and procedures, the entity will demonstrate how they will prevent duplicate discount, which is yet another compliance cornerstone that we reviewed earlier in the presentation. This is the section where the entity will state their decision for Medicaid, whether it will carve in or carve out, and state how the entity will abide by any and all Medicaid billing and reimbursement requirements to prevent duplicate discounts. In the next section of the policies and procedures, the entity has an opportunity to highlight their 340B team, their role and responsibilities towards implementation of a compliant 340B program. This will be the section where entities will also discuss details of the 340B Oversight Committee, including who is on the committee, the cadence in which the committee meets, various agenda items that are discussed within the Oversight Committee. This section is also good to highlight the entity's commitment towards 340B education and training, what the entity does to ensure that everyone who works with the 340B program is trained, what resources are used to train the staff, and how the training is specific to 340B roles. In the following section, the entity will discuss their process for managing inventory. So this will be the life cycle from ordering, receiving, storing, to replenishing it again. This will be defined for all different 340B program areas or universes that we talked about earlier. This section of the policies and procedures will also outline all of the purchasing accounts, process for returns and waste. And in this section, it's also important to note the split billing software vendor that the entity is using and their settings that help maintain inventory for your entity. In this next section, we'll want to highlight how the entity oversees program compliance by disclosing the entity's plans for self-audits, internal audits, as well as external audits. This will include the cadence of audits and mechanism to report out any audit findings. And with audit comes the responsibility to state how the entity will handle instances of non-compliance, along with defining the material breach threshold specific to their entity. All right, we've spent a good bit of time talking through the different areas of the 340B policies and procedures and what should be entailed in each of the sections. Now let's pause for a quick knowledge check to see how all of us are processing this information. So again, we'll utilize the chat to help gather the responses. Which of the following would you find in the site eligibility chapter of the policies and procedure manual? A, registration documentation, B, material breach threshold, C, list of purchasing accounts, or D, internal audit plan. And again, Judy will lean on you to help us gather those responses.
You bet. I am seeing A for the first couple of answers that have come in. Mostly A's. I do see a C. Otherwise, we're looking at A's. Yep, all A's.
Fantastic. Great. You guys are following along, and yes, it is in the site eligibility section of the policies and procedures where you will find this registration information. And with that, I'm going to hand it off to Nick, who's going to now walk us through operationalizing some of the concepts that we've talked about within the 340B policies and procedures.
Awesome. Thank you, Shamrose, for providing an overview of the different components of some of the things we can find in a 340B policies and procedures manual. In this next section, I really plan to just review how each of those different components not only impact 340B compliance, but also day-to-day pharmacy operations, some of which you may or may not even be aware of. So before we jump in, let's do one more quick poll. We like to keep the audience engaged as much as possible. But just to see how familiar each of you are with your organization's 340B policies and procedures. So I know some of you guys said that you're not at a covered entity, or that maybe you work with a covered entity. But if you have a 340B covered entity, if you work at a 340B covered entity, do you know where your policies exist? So yes, I have reviewed them as A. B, I know where they are, but I've never looked at them. C, no, we have those. Or D, not applicable. We're not associated with the 340B program. So Judy, I'll get you to help me with the chat as well. Just send your answers there.
You bet. It looks like we're having A, B, and C. No D's have come in. Otherwise,
Okay.
mostly A, B's, and a couple of C's.
Awesome. Well, that's great. I'm glad to hear that some of you guys are familiar with your 340B policies. Others of you might know where they are, where they're located, but you might not have paid a lot of attention to them. And then some people are like, what is that? And that's perfectly fine. So I hope that in this next section, I'll be able to draw a direct connection between your policies and your 340B policies and procedures and some of the workflow that you might be in day-to-day operations. So this slide shows a really consolidated summary of the retail pharmacy workflow. Now, we all know that it can be much more complex than this, but for the sake of time, this is just an outline of the major steps involved in filling a prescription and processing it in the retail space. So first, a prescription is received by the pharmacy and data entry is completed, and that's just where all the necessary details are entered into the software. So that includes patient information, insurance details, prescription data like NDC and things like that, along with other data points. Second, the claim is submitted and the process of adjudication occurs to determine the payment. So if the claim is accepted, the payment details are sent back to the pharmacy with information like the copay amount, and the prescription can then be filled. We know that sometimes it's not always that straightforward, and there's a lot of in between involved. And then if payment and everything goes through and adjudication is successful, the pharmacy to fill the prescription, they must have the correct product on hand. So if the correct item is not in stock, the pharmacy has to place an order through their procurement system and receive the medication from a supplier or a distributor. And then after the pharmacy obtains the correct medication to fill the prescription and all of the patient co-payments have been made, the prescription is then released to the patient so they can administer at home. So now that we've reviewed the retail pharmacy workflow, let's take a look at a case study. And the goal of this, like I said, is really going to be to help draw some connections between the different components of a 340B policy and procedure manual that Shamrose covered and the day-to-day operations of a pharmacy setting. So put on your creativity cap with me for just a moment and imagine that you are a pharmacy technician staffing in the Hillville Hospital outpatient pharmacy. So note that Hillville Hospital is a 340B covered entity, so they are registered and participating in the 340B program as a disproportionate share hospital or DISH. While you are staffing at the outpatient pharmacy, a 35-year-old female patient approaches with a prescription written by Dr. Payne which is a fitting name for a doctor, right? Or perhaps one that would drive away patients. But the patient approaches with a prescription from this doctor to the counter. And as the technician working that day, you take that prescription and complete the necessary data entry steps to enter in all the details into the billing software. So you submit the claim is adjudicated, but when you go to search for the product on the shelf, you realize it's not something that your pharmacy normally carries. So it'll have to be ordered. You explain the scenario to the patient and tell her that the drug will arrive within the next few days, and she kindly agrees to come pick it up at a later time. So you find the correct product that will need to be used to fill the script for the patient in your procurement catalog online, and you add it to that day's order. You process the order through normally, as you were previously trained to do by your organization's pharmacy purchasing manager. The drug comes in the order on the next day's truck when it arrives. You receive the product, you fill the medication, and put it in a storage bin ready for pickup. The patient comes in the following weekend to pick it up. She pays her copay and she leaves with the medication. So now let's play that exact same scenario back one more time, but now we're going to tie in the 340B policies and procedures and how they might affect the various steps taken in our case study. And I hope that we'll be able to see from that how closely the two are actually intertwined. So in the first part of our case study, we know that Hillville Hospital is a 340B covered entity. So that would tie into the site eligibility chapter of the policies and procedures manual, where, like Shamrose covered, important program registration documents would be like listed, and would be a record there, along with the locations where 340B drugs are dispensed or prescribed. If the outpatient pharmacy that you're working at here in the case study participates in the 340B program, it would be listed as like one of those entity-owned pharmacy locations within the policies and procedures manual. And it would also be listed as a ship-to location on 340B OPACE. In the next section of our case study, we learn about the patient that approaches with the prescription from Dr. Payne. We know from our 340B compliance cornerstones that in order for a prescription to qualify for 340B, it has to match a variety of different eligibility tests. So it must be written by an eligible provider from an eligible location, and the entity must have documented responsibility of care for the patient. And 340B compliance, 340B eligibility is all or nothing, so it has to match all of those in order to be eligible. But because of this, there are two chapters from our policies and procedures manual that would really come into play here. So both the site eligibility chapter and the patient eligibility or patient definition chapter would come into play. So where was the patient seen? Where did the encounter take place that this prescription was written from? And is that location eligible for 340B? These are all questions that we'd have to kind of look in our site eligibility and patient eligibility chapters to determine the answer to see if it could qualify for 340B. Additionally, we'd have to see if Dr. Payne is a credentialed provider and is responsibility of care documented for this patient, like within our EHR system, for example. So those are just some questions that we'd have to research into our policies and procedures to determine how our entity handles all of those different scenarios and counts eligibility off of them. In the next part of our case study, where this claim is submitted and adjudicated, it would include entering payer information and filling out all of the claim fields that are involved. The duplicate discount prevention section of our policies and procedures manual could impact this part of the workflow because depending on the entity's carve in and carve out decision and their state requirements, which would be documented in the duplicate discount prevention chapter, there might be specific claim modifiers, special payer profiles, or other billing settings that need to be used for Medicaid patients to ensure that no duplicate discounts occur. Next, we discover that the medication will have to be ordered. Ordering and procurement procedures would be documented within the inventory management chapter of our 340B policies and procedures, where our inventory model, whether it's separate physical inventory or replenishment inventory or a hybrid model, um, along with the purchasing, receiving, storage, and replenishment process for 340B drugs in each different setting, is outlined and discussed in detail. Additionally, any ordering issues or mishaps are also usually addressed in this chapter, which would be helpful to know if you were to accidentally place an order on the 340B account that isn't supposed to be there, or if other issues with products arise, like how to return certain products or borrow loan type considerations. They would all be listed in that section of the policies and procedures. And that would be the best place to look in order to manage those situations while still maintaining 340B program compliance. And you probably have a lot of, if you are working for a 340B covered entity or contracted with one, your workflow is probably written based off of those policies and procedures. So it might make sense why some of the things you do on a day-to-day are the way they are, because they tie back into those compliant practices for 340B. So when you place the order, the process that is used would be documented in the policies and procedures manual as well, in that inventory management section. And that would include details about which purchasing accounts need to be used for ordering, as well as any sort of split billing requirements if applicable. And many times, if a split billing solution is in place for a covered entity, there might be additional steps to take when completing a purchase order. You might have to like export the order and put it back into a different software, or punch it out to a different solution to see which drugs can be purchased on the 340B account and which ones have to be ordered on different accounts, to ensure that compliance with the 340B program is maintained. And additionally, this step in our case study mentions that you were trained by the pharmacy purchasing manager on how to order products and what methods to take when placing orders. And so the training and education of frontline pharmacy staff on workflow operations that impact the 340B program is often a responsibility of the 340B team or other pharmacy leadership. I personally, when I was working at a CE, I trained all of our frontline pharmacy staff on ordering and procurement practices to make sure they were compliant with the program. And so those details would also be listed in the 340B program roles and responsibilities chapter of the manual. That would include information like onboarding plans for new hires, guidelines for determining purchasing account access, and other related information. So when we hired new employees, like I would meet with them, I would train them, give them their access to our purchasing accounts and things like that. So all of those responsibilities and who is the right person to kind of oversee that should be listed in that 340B program roles and responsibilities section of the policies manual. And lastly, the medication is then filled and the patient receives the drug. And so procedures and workflows surrounding filling the prescription could be impacted by that inventory management chapter of the 340B manual. I know we've talked about that chapter a lot with this case study, but it really does impact a lot of different steps of the workflow, especially in the retail setting. But for example, there might be a separated shelf of inventory that should only be used for 340B eligible prescriptions. Like if your institution is using a separate physical inventory model to maintain compliance. And all of those details would be included in that inventory management chapter of the 340B policies and procedures manual. So I encourage you, especially if you're working frontline at a covered entity or contracted with a covered entity, that you take some time to look over the entire policies and procedures manual, but specifically that inventory management chapter, I think would be really helpful in determining some of your day-to-day responsibilities. So I hope that through that case study, you're kind of able to see just how much 340B policies and procedures can directly shape workflow and daily operations. So let's do another quick poll here. So which of these pharmacy workflow steps correlate to 340B policies and procedures? Is it A, prescription data entry, B, claim submission and adjudication, C, ordering and purchasing, or D, all of the above?
We're getting a lot of D answers in. In fact, everyone's answering D, every single person.
Oh, perfect. So I'm so glad to hear you guys were engaged and hopefully took a lot away from that case study. So yes, the correct answer was D. All of these things directly correlate to 340B policies and procedures. So thank you guys for answering that question and being involved in today's presentation. And quickly, I just want to highlight some other resources that are also available to help you with 340B compliance at your covered entity, or if you're contracted with a covered entity, in case you ever have questions or just need additional support with 340B related items. So there are really two different buckets of tools, of resources available to help you with compliance. Some are individuals and others are tools that are at your disposal as well. So if your entity has a 340B team, which might consist of program coordinators, managers, analysts, auditors, and even purchasing and supply chain individuals, that is a great place to start if you need help with 340B. So if your institution is involved with 340B, somebody on that purchasing and supply chain team probably knows the right people involved with that because they have to work so closely together. So that's a great place to start if you ever need help with 340B. And additionally, pharmacy leadership that's involved with the program, like purchasing managers, business managers, directors, and other key stakeholders can also typically provide support for 340B or point you to the right person that can do that. And members on your team that have been with the organization for a while and who have a good amount of experience under their belt, they're another great resource for you to be able to ask questions to, because even if they don't know the answers directly, they should be able to help point you in the right direction to get you the assistance that you need. And as far as tools go, there are a few different places you can check to access 340B documentation and assistance. So if your entity has an intranet or policy site where all of the policies are stored, that's a great place to check for your 340B policies and procedures manual. It's probably saved up there somewhere. You might just have to search for it. And then additionally, shared folders and shared educational materials stored in like a document specific local drive. That's another great place to check for reference and help with 340B. And lastly, training manuals and quick reference guides that might be posted around the pharmacy or the workflow area, like cheat sheets for certain operations and things like that. They might also contain 340B compliance tidbits that are helpful for day-to-day tasks. And if you're looking for just general tools and information about 340B, the Apexis 340B Prime Vendor Program site has a lot of great resources for that as well.
Awesome. Thanks, Nick. All right, so in this last section of the presentation, we want to spend some time talking through the opportunities for pharmacy technician advancement through involvement in the 340B program. Both Nick and I have very similar stories of how our experience in 340B really served as an opportunity for us to advance our careers. So we wanted to talk through what that might look like for some of you, and then of course tying it back to today's topic of the policies and procedures that we've just talked about. Now let's start at the introductory level. Say you're someone who doesn't have very much involvement with the 340B program at all, but maybe you're interested in it and you want to learn more about it. Apexis offers a ton of foundational level education that you can complete that will teach you the basics about the 340B program. Our 340B University on Demand is the biggest resource for intro level, but we also have several pieces of supplemental education that can help teach you about the specific entity types, requirements specific to entities, and provide highlights for specific operations. Something that you can do at this introductory level would be to locate your entity's policies and procedures and to read through the manual and familiarize yourself with this document, which will really help you understand the 340B program at your institution, what the structure is like, and hopefully why certain procedures are in place. To take it a step further from there, we would recommend more intermediate education. So for example, if you fall in this category, attending a 340B university in person, which is an 8-hour session that we offer at different pharmacy conferences throughout the year, would be a good choice. Additionally, if you're involved with buying and purchasing at your institution, we also offer purchasing office hours where you can meet one-on-one with Apexa staff that can help answer your 340B related purchasing questions and also help you navigate the PVP Secure site. There are also webinars, virtual events, and other supplemental resources that the PVP program offers throughout the year that's focused on intermediate level topics that can help you better understand the 340B concepts. For more intermediate involvement with the 340B program, you would take it a step further and really try to understand your entity's policies and procedures. You could even check to verify the workflows listed in your PNPs are actually accurate and that they really describe what is happening in your day-to-day operations. Lastly, after those previous steps are taken, the next step would be advanced level education. So this would be where the Apexis Advanced 340B Operations Certificate Program would come in. And this is the course that our team, Nick and my team leads. And it's really a deep dive into 340B operations. This is where we take, policy and connect it to practice in your everyday work. So at this point, you might be starting to work directly with the 340B team, in which case the OpCert program would be a perfect resource for you to kind of help you prepare for the ins and outs of what that work looks like. After you've gotten to this point, you can really start to get involved with your policies and procedures by helping to develop new policies for operations as they change or evolve, or identify new workflows. You can help make existing policies better and improve them just, by helping with identifying any workflow that's broken and how to make it something that would be considered compliant and including that in your PNP. And then after you learn all about the 340B operations and compliance, you can start to look at the workflows and offer suggestions that would increase more compliance in the 340B policy. These are just a few ways in which, pharmacy technicians can get involved with the 340B program and ways in which they might utilize different education and resources for career advancement. We do want to spend some time answering any questions you guys may have. And, here Nick and I are also happy to answer any questions that you may have about our specific 340B journey leading us to where we are today.
I'll keep an eye on the chat and let you know if I have any questions come in.
Awesome.
Yeah, maybe in the meantime, Shimrose, while people are getting their questions together, can we just both quickly share how we got to where we are, like in a little bit about our career
Yeah,
journeys? Yeah.
absolutely. Okay, so I'll share a little bit of where what my background looks like. So I started as a pharmacy technician in high school, working at retail pharmacy, like at a neighborhood retail pharmacy. Really enjoyed it. While I was in undergrad, I started picking up shifts at the hospital where I was going. It was an academic center at Emory, and I started picking up hospital shifts at the pharmacy and patient pharmacy. And then from there, I had a lot of interest in like the inventory management system. We had Omnicell, so I helped with like the implementation of that. It kind of rolled over from there to like controlled substance oversight and management. A lot of audits kicked in at that point with controlled substances. And then that led me to 340B program. One of the entities within the Emory Healthcare umbrella was 340B covered entity. And then I started working. I started by doing audits for the 340B program and built my way up from there. And from Emory, I came here to Apexis to work on the program that all of us took as a team together at Emory and became ACEs. So it's been pretty cool. Nick, what about you?
Yeah, so we joke sometimes with Shamrose and I about how similar our stories are because there are a lot of similarities. But I started working at a local small retail pharmacy when I was 15. I got my work permit to run the register there, and I thought it was like the best thing ever. And then I started working as a technician a little after a few years, kind of helping out in the pharmacy. And then when I was in college, I started working at the main hospital at UNC Healthcare as like a per diem pharmacy tech in the inpatient pharmacy that could just like help when there were call outs and like other things because it was flexible and I could do it outside of my class schedule. Um, and I kind of got involved with like our inventory and automation there. So we used Pixis and like just getting involved more with like optimizing the drawers and like how the QVs were set up. I really liked that. And then I ended up covering for our controlled substance vault as well, like helping them. And then I took a team lead position, like training new hires, and then I took a management position. So I oversaw about 25 techs. I had our inpatient day team and our pharmacy storeroom team under me. And so I got to see a little bit more of the ordering and procurement process with that. And then I went to Chesapeake Regional Healthcare, where I was their 340B program coordinator, and I helped a lot with their buying team. And got into 340B. We built a program from scratch, and I learned all about it. Got my ACE with Apexis, and then discovered that I had a passion for education. And so Apexis was a perfect next step for that in my journey. So I think just through Shamrose and I sharing, I hope that that is testament to just some of the advancement opportunities that are available, and if you're interested in 340B, it is a great way to kind of work and create a career. I think I love where we are in time and kind of like history where more and more people are creating careers out of being a pharmacy tech, and there are so many opportunities now compared to just like 5 or 10 years ago. So I think it's just a really exciting time